I'm thrilled to be here, so thank you for coming. I know we have a small group, but this is going to be a highly beneficial little working session that we have for Sharla and I. So we divided it up into two areas. First, I'll be speaking, and we're having our working session on finding your life purpose. And even if you have it figured out, it may trigger some thoughts for you to think about. And then second, Sharla will be speaking on cultivating your passion into your career in the healthcare world and how to navigate that. So by the end of my 15 minutes today, you'll have the components you need to be in alignment with your life purpose. We'll be doing individual exercises, so be sure to have a handout. I had some sitting in the aisles here. Does anyone not have a handout? All you need is a pen and a handout, just to make sure. So the 5 tips today that I'm going to share with you about finding your purpose are taken from an article from Jack Canfield. He's America's #1 success coach, who's the co-founder of the billion-dollar book brand Chicken Soup for the Soul. Some of you, I'm sure, have heard of it or maybe even read it, so I encourage you to do so. He's also a leading authority on peak performance and life success. And within these 5 tips, I added a little bit of my own sugar and spice too. So according to Jack, if you want to be fulfilled, happy, content, and experience inner peace and ultimate fulfillment, it's critical that you learn how to find your passion and life purpose. Without a life purpose as a compass to guide you, your goals and action plans may not ultimately fulfill you. So my first questions for you are, what do you love to do and what comes easy for you? We all have an innate ability to do certain things, and so those are things that are already given to you as when you were born, you had them, and they have already been developed. And so for you to uncover all those, or just a couple of them today, is really what my goal is. The key is really alignment between passion, values, and strengths. Today we're going to journey through a few exercises that prompt you to think deeply about your passions, your unique values, and your strengths, and ultimately to find your purpose. In this Venn diagram, it's really in that middle area where your purpose is. When you're properly aligned in these areas, you're balanced in your true self and what you are to give to the world. So first, I want everyone to close your eyes and imagine a place where you are happiest and the kind of work you're doing. Think about your ideal job and your ideal place. Are you working in that place now? Is that the place that you're seeking and that's why you're here today? Think about it for just a minute. Keep that image and save it for the end of the presentation. So let's start by finding your passion. So first we're going to conduct a passion test. We're all born with a deep and meaningful purpose that we have to discover. Your purpose is not something you need to make up. It's already there. And so we're going to uncover it in order to create the life that you want. So this passion test was developed by Chris and Janet Atwood, and it's just a simple process where you start by filling in these sentences 15 times. And so for the sake of time and structure on the slides, I just did 5 of them. But ideally you would do 15, and then you select your top 5 from there. And so I had listed a few of the verbs at the bottom too that I could think of, but really what the process is all about is you're creating a statement that's about specifically you, with the first word being verb. So for example, for me, my life is ideal when I'm influencing people in a positive way to reach their goals. And then my second one, my life is ideal when I'm encouraging people to find their intrinsic motivations. My life is ideal when I'm working with people to find their strengths. My life is ideal when I'm teaching people to confront their challenges and overcome them. And my life is ideal when I'm exercising gratitude in every moment of my life. So I want to give you just a minute or two to think about what are those verbs that resonate for you. Is it you're in the healthcare industry? Perhaps it's caring, maybe it's cultivating, maybe it's giving. I listed just a few of the verbs at the bottom there, and you can certainly select them or circle them, but I want you to really think about who you are. What verbs are your verbs for who you are? Okay, let's move on to number 2. The second step is looking at your values. I've listed a group of values here too, but we are deeply shaped by our values. Practicing your values brings meaning to your work and allows you to be true to your authentic self. If you're not sure what you value, one exercise you can do is simply write a paragraph about a life-changing event that you've had in your life. It can be positive or negative, but if it's, they call it a crucible, and it's really what molds you in your life. And so if you don't know what you value, that's one way to do this. A lot of times you can kind of select a few of them out of this list, but when I did the paragraph and I went back and I looked back at the values that resonated within that paragraph, I could really see clearly of what I truly value. And so I encourage you to do that. If you haven't done that, that's one way to be a sure formula for finding your true values. For the sake of today and for this exercise, I encourage you to select your top 3, and I'm sure you're pretty close on what those could be, but it's really what are the 3 values that I most enjoy expressing in the workplace or in the world. They're both. They should be balanced. Whatever you have in the workplace should also be at home as well. And so mine are courage, discipline, and gratitude. That place who I am and what I have to give to people. And then think about how you enjoy expressing those values. Mine are motivating people to have the courage to reach their goals and exercising discipline and gratefulness along the way. And so once you identify what those top values are, you can create sentences around that. And all this is going to fit together at the end of this presentation when we actually create a life statement for you. So I encourage you to just take a minute and select your top 3 and write them over on the left. Okay, the next piece are strengths. So this is a book where you can actually take an assessment. If you've heard of Strengths Finders, what they do is it's a book filled with all kinds of strengths, and when you go through the assessment, it's really they're asking you questions throughout the assessment, basically of what's important to you, what do you give to the workplace, what do you give to the home place. And so this is if you buy the book, in the back of it there is a actual combination. You can go onto a website and take the assessment. I encourage it. I've done this with all my teams that I've managed, and what it does is help you understand what your strengths are, but also if you do it with people you work alongside, or even if you do it with your spouse or significant other, you can certainly find out what their strengths are too, and it'll all rise to the top. And literally what happens is they send you a printout and everything of your top strengths, and the first one's always the most dominant one. So mine's the maximizer. I'm a maximizer. I want to maximize my use of this time today. I want to maximize my team in the best way that I can by knowing what their values are or what their strengths are, and that way I'm actually able to allocate projects to them. So that doesn't always work at home with my husband, but you can try. And so I encourage you to think about this. When are your most powerful moments when you're exemplifying your strengths? And so I encourage you to think about that. On the next slide is where I have them all listed. And on this page, Strengths Finder actually divides it into 4 categories. So there's the relating category, the influencing category, executing, and strategic. And so you may kind of already know who you are and which category you'd fall into. So if you're in sales and marketing, of course, you'd fall under influencing. If you're in the healthcare industry, you'd probably have a few under relating because you want to be personal and if you're a caregiver. So maybe you're in executing, you have something where you're really focused and you're consistent. That's also really good in whatever position you're in, so that you can be reliable, you're consistent with everything that you're doing. And then there's that strategic approach. So maybe you're looking at a high level all the time as opposed to the tactical ways. And so I encourage you to select your top 3 of what you think they are, and I'll give you a minute to do that. Okay, next is a life statement. So what you do on this slide is literally take what you've selected on the verb, the strengths, and the values, and you'll write a life statement for yourself. And so this is really a description about what the world will look like if it was operating perfectly for you. So in this statement really is alignment between your passion, your values, and your strengths. And so this will give you your clear purpose and when you're operating at your fullest potential. So, for example, mine is when I'm teaching and writing, I'm reaching my potential to maximize and provide individual approach to situations and to exercise the importance of me to find fulfillment in my need for courage and gratitude in all that I do. And so you can add words into it to customize it for yourself, but this is literally you as a person, where you're operating at your fullest potential. And this is where Mr. Sim was actually talking about his mission. Know your mission and know what you bring to the workplace and where you are at home. It should be a true balance between all of those three items in order to be operating at your fullest potential. So I realize everybody's at a different place in their career, and maybe you're not at your true balanced self in your position right now, and maybe it's a career ladder that you're going for, that end position where you actually will have that. So there's also some things that we have to give a little on the way through our career path. And so I understand that too is not always going to be ideal, but just recognize that you need these things in line to perform at your highest potential. So if you don't have it in the workplace, you have to find it on the side in your personal life so that you're operating at your fullest potential. So I encourage you to think about that and go ahead and write these down, and you can always come back to it too. Okay, once we've combined all of that together and you have your life statement, I just wanted to ask you a few questions about your own personal alignment. And so here you have your career choices on the left and then the alignment of your passion, values, and strengths. And so are you in alignment with where you're going as a person? Think about it for a moment and decide if you're pursuing a career that blends all three of these together. You were born with an inner guidance, and your inner guidance will tell you when you're on and off key and off course by the amount of joy you're experiencing. So you want to make sure that you actually are experiencing joy in the workplace too. So the things that bring you the greatest joy are in alignment with your purpose and will get you to where you want to go. And finally, be crystal clear about your life purpose. Once you're clear about what you want and you keep your mind consistently focused on it, where you need to go will keep showing up, not a moment earlier, but just when you're ready to see it. So some things that may not have been open to you over the last few weeks or months, now that you kind of have zeroed in with who you are and where you're going, it will become more and more obvious, and it'll keep knocking on your door. It may come through people, or it may come through a book or the news. You don't know, but it's going to resonate somewhere when you're ready to see it. So I ask you, what brings you joy? What financial status are you desiring, and where do you want to be? If your life were perfect right now, what would it look like? What kind of job would you have, and where would you be living? By continually doing this exercise, you'll send powerful triggers to your subconscious mind to help you get there. Another thing that's very helpful is journaling. And take some time, but your subconscious mind is always working overtime, and it's not until you start journaling when you can actually see some of the things that your subconscious mind is really picking up on, and that can also help drive your life purpose and who you are and where you want to go. So now I'm going to ask you the question about your image that you had in the beginning. Think about that image of your ideal job and your ideal place. Does it align with your passion, values, and your strengths? It's a question for you to answer. So next up is Sharla to help cultivate your passion into your career. So I'm going to turn this over to her. Thank you for your time.
Hi everybody, I'm Sharla Gallegos. I work at Denver Health at the Denver Health Nurse Line. I'm the RM program manager there. And so now everybody's got their passion figured out. Now it's time to kind of navigate the healthcare field, which can be really daunting. There's so many paths in healthcare. There's so many certifications you can get. There's so many jobs in different areas that if you know exactly what you want and how to get there, congratulations, that's awesome. But you are definitely in the minority. So now that when you kind of start zoning in on that passion, then it's time to start thinking about your check boxes. When you're looking for a job that you want, you need to check your check boxes off too. It's not just about that company looking for you and finding you good enough. It's about you finding them good enough. If you're somebody who needs to work around people, you don't really want to apply to that job that's going to have you working by yourself 95% of the time. It's probably not going to be a good fit for you. So just a little bit of background about myself. I've been a nurse for about 8 years. It's my second career. I started out in food and beverage, is a fancy way to say I was a waitress for a long time. I was a bartender for about 10 years. I managed a restaurant for one of my bar customers who said, "Hey, I just bought a restaurant. You want to run it for me?" And I said, "Sure, why not? I've never done that before." And so I kind of worked my way up in that. Then I dropped my son off at college. I had him when I was 15 and got married when I was 15 because that's what 15-year-olds do, right? They know everything. So I dropped out of school in the 8th grade, and when it was my turn, and I went and dropped my son off to school, I said, okay, now it's my turn to live for me. So this is a little bit about my story. And my word this year has been cultivation. To cultivate your career and cultivate yourself, you're growing, you're raising yourself, you're bettering, you're planting seeds for the future. I believe that a career is grown. There's very few success stories. It's not gonna land in your lap and you're gonna have the perfect job tomorrow or maybe even at this health fair. If you do, awesome, that's great, good for you. But contrary to popular belief, you don't necessarily get what you wish for, you get what you work for. And to cultivate anything requires work and it requires intention. It's okay not to fully know the how of, okay, this is my passion and this is where I want to be, but how am I going to get there? It's okay not to know that fully. The average person has 12 or 15 jobs in a lifetime. That's okay. It's okay to change your mind according to your changing interests. I bet most of you don't like the same thing that you liked 10 years ago. That's all right. So I know that I told you a little bit about it, that it's not super important to know the how, but I know that that's why you're here. So I'm not going to bury the lead, and we'll kind of jump into the how. When I told you about me dropping out of school in the 8th grade, when it was time for me to go back and become a nurse, because my passion is to help people, I realized that I needed to go back to school. So by then I had gotten my GED, but it was time to start my prerequisites. So I went to the college and I sat in the parking lot and I watched the 18-year-olds with their backpacks and their shiny faces, and I cried. And I drove away, and I didn't go back to that school for 18 months. And I let fear get in my head. And the thing is 18 months later, when I finally went back, there were people, because the time still went by. In 18 months, I was 18 months behind of that nurse who had, she'd already gotten her LPN by then because I let that fear get inside my head. So my first piece of advice is just start. Just start wherever you need to be. If you're a CNA and you want to be a nurse, start your prerequisites. Take one at a time, take two at a time, whatever you need to do. If you're a medical assistant and you're not certified, become a certified medical assistant. Just start taking the steps you need to do, whether it's school, is it specific training that you need? Volunteer, entry-level positions, anything that is going to take you further down the path to that goal is going to help. Somebody asked earlier at the first session, I think it might have been you, I'm not sure, it was a new grad anyway, and they asked about how do they stand out as a new grad. And one thing that I did is I started volunteering. There's health fairs going on, I believe they're this month. Volunteer at that health fair. Start drawing blood. If you're a phlebotomist, get in there and volunteer for things. I went on a medical mission to Haiti, which was amazing, and it actually helped my career because I was able to put that on my resume, and it made me stand out. Somebody saw it on my resume, and they actually told me later that that's why I got the job. So anything that will take you, even if it's not getting paid, anything that will take you closer to that step of your passion and your goals, do it. Next is, I think you should identify a mentor, and I know that was mentioned previously before as well. I've had two really great mentors in my nursing career. One of them is sitting right there. She actually hired me, she promoted me from within the nurse line when I was a staff nurse and asked me to be the program manager, which was more of the business part of nursing. And I'd not really done that too much. I'd had a little bit of experience, but it was nerve-wracking. I was scared. It involved a lot of math. Oh my God. I was really scared, but I've never started a job that I knew 100% I was going to be able to do it. And don't cover your ears, but I wasn't really sure, but I saw what she had, and I wanted what she had. I saw her dedication and her passion, and I saw her skills. The stuff that she knew how to do, I wanted. So I found a mentor, and I worked with that mentor. When she called me and said, "Do you want to do this today?" I said, "Ooh, I don't really like speaking in front of people, but yeah, I'm definitely going to be there," because you have to actually work with them. You can't just watch them from afar and hope that it will come to you through osmosis. You actually have to work with them. Look for areas of growth in your current job. So in the current job that I'm doing, the RM program manager, it was a lot of business stuff. But my passion and my goals involve clinical care and developing people and working with people. So once I got that part down, I started looking for areas in my department where I could grow. And it's my job to keep myself engaged at work. Kathy has since moved on from Denver Health, but I'm still there, and it's my job, it's not my supervisor's job to see what I need to do to learn. She doesn't come to me and say, "Well, it looks like you could learn this." That's up to me. So I'm currently I lead the recruitment team at the nurse line. So I'm the first person you have to get through at the nurse line to get a job there. And I did that because I realized a need. So I went to my boss and said, "Let me take something off your plate because I'm good at this. And I'm going to help develop my staff," which I started supervising the charge nurses because that's something I like as well. So I took that on. So it's free work for my boss, and it's development for me. So it's a win-win situation. So look for areas that you can grow in your current job. Grow your job description. Don't let the job description define your job. You can do more. So I'm going to talk a little bit about transitioning. And the other word that some people call it would be climbing. And I know climbing can get a bad rap. It has a bad connotation of, climbing the corporate ladder. But I encourage you all to climb for that next rung. Look for that next opportunity. The previous speaker did mention this as well. He kind of stole my thunder in a lot of stuff. But you have to keep reaching. You have to keep striving in everything that you do. There's going to be opportunities. Don't let that fear get in your head. If there's something that comes up that could possibly take you to the next step, reach out for it. Change companies if you need to. I mean, if Kathy was at Denver Health, she was at the top of her game at Denver Health, but she saw something that could take her to that next rung. She didn't let fear stop her. She kept going. Act as if you have the job you want. My supervisor right now is overwhelmed. I would like her job. I don't make any bones about telling her that. I'm not rude about it. I would love to do her job and be in that position someday. So I take on anything that she needs me to do, and she'll let me take over. I'll do it. I don't think you should climb for the sake of climbing. I don't think you should be job hopping. That's not what I'm recommending. I'm talking about growing. And that being said, the reason why climbing has a bad connotation is because there's other people on that ladder. And if you're stepping on people's fingers as they're trying to get up, that's going to come back on you, because you never know when that person's going to surpass you, and they're going to be the person you're interviewing with, and you've stepped on their fingers. So in my climbs, in my careers, in both of my careers, I've never hurt anybody. I've never badmouthed anybody to get to where I am. I'm doing it for me, and I'm doing it with excellence. Every job I have is not a job for right now. It's my best job, and I'm going to do my best every single job that I have. And if I concentrate on the little things of this job, it's going to, the big picture will work out, and you're going to do it with excellence. If you act with grace and integrity in everything you do, you never know who is watching. You never know who is going to notice. I was on a clinic improvement team, which I formed at a clinic that I worked for, because it was something that I saw that was needed, was some pill boxes for our patients, because they weren't taking their pills and they didn't have pill boxes. Where are we going to get the money? We ended up doing a yard sale, a big yard sale that I kind of coordinated, and it was so successful. We had so much money for pill boxes that we had money left over for diabetic education materials. I did that with excellent because I did it for my patients, but my leadership team saw that and I was promoted partly because of that. So I just want you to know that if you focus on the job that you're doing right now and doing it the very best, people will notice. And then we're going to take just a tiny detour into self-care and cultivating joy. Burnout is a big topic in healthcare career, especially in nursing. Healthcare is hard. There is addiction, there is high levels of burnout, there's physical, you'll hurt yourself at work because you're not taking care of yourself. And if you're not taking care of yourself mentally, physically, emotionally, spiritually, it's going to be really hard and you're not going to be able to get to where you want to be. You are the key factor in your goals and you can't leave that part out. And I'm sure you've all heard that. You need to take care of yourself first. But how many of you really do it? That website, by the way, is the Institute for Healthcare Improvement. They've done a ton of work on cultivating joy in the workplace. It's a great place. It's a great one to look up. And it's not just about the absence of burnout, it's cultivating joy in yourself every day before you go to work. And like I said, it's your responsibility to yourself to stay healthy. So what matters to you? What do you need to do to stay healthy? It might be different for you than it is for me, or for you than for me. For me, if I don't exercise, I get depressed. I don't want to exercise. I don't want to get up in the morning, but I know if I don't do it, I'm not going to be good for my job. Are you doing it? If not, why not? Figure out the barriers. Do you need to say no? Do you need to set some boundaries at home? And then my soapbox piece is positivity is a habit. I'm not born positive. I don't think a lot of us are. I don't get up in the morning and say, woo, I get to go to work today. I'm so excited. I don't. But once I started practicing positivity, and I say practice because it's not perfect, there are still some days that I spill my coffee on myself before I leave and I'm just like, and getting into the car and open the door on my face. I just did that last week. But I get to decide what goes on within me. I can't figure out what's going to happen outside of me, but I get to decide. I get to choose to be positive. There's been tons of studies about gratefulness and positivity in your attitude and your happiness and how it correlates. I'm actually participating in a study right now through Duke University because I had the opportunity to listen to a speaker, Brian Sexton, who is a psychologist at Duke, and he has found that gratefulness and positivity does just as much, if not more, and lasts longer for your well-being than an SSRI, which is like Prozac. So since I started this, and it was actually before I got to listen to him, I was starting my gratefulness journal, and it was during my commute to work of what I'm grateful for. Now I get to the certain point in my commute, and I start listing them off, everything that I'm grateful for, and it's coming to me easy, and I'm realizing people don't make me mad on the road anymore, and that in itself is a win. But when I get to work, I am a much happier person. My family's noticed, my supervisors have noticed, and my coworkers have noticed. So I start each day with a positive intention or gratitude, and I know it seems kind of silly, but I actually have these little signs of, I decide each day, what's my intention going to be today? And today, our beliefs become thoughts, our thoughts become words become our habits become our values, and our values become our destiny. That's my intention today. And so I just put that up, and I can do anything for 24 hours. So anyway, that was my soapbox. Positivity is a habit. So back to the how. Get certified. There are tons of certifications out there. For nurses alone, I've got, I think it was a 6-page handout of different certifications. There's a link at cha.org that you can download that as well. And I have some extra copies if you want them. Just grab them till they're gone. If you turn in an application and you're certified, and you turn in an application and you're not certified, I'm going to pick you first. So it's just a way to make yourself stand out as those certifications. Networking opportunities. This is a great networking opportunity. Talk to the person next to you. Find out what they do, where they work. Give them your business cards. Make business cards. Buy business cards. Continuing education units oftentimes will be paid for through work. Take advantage of those. You will learn so much, and you can put those on your resume. People like to see that when they're looking at your resume, that you're invested in yourself and your education, and that you're going to keep growing. Always have an updated resume. Make sure that you're putting stuff on there. Don't wait until you find that perfect job, and then you have to remember, now what did I do, and what were my job duties there? Update it on a regular basis. And sometimes you go back and you see a typo. Make sure you fix those typos when you're in there. Always make sure the updated resume is ready to go. And then if you don't take anything away except for this, I highly encourage that you maintain a me file. This is where you put in your file. It can be electronic, it can be paper. I have both. Anytime your boss tells you, hey, good job on that presentation, or you did something at work and you get some kind of recognition, put it in that me file. When it's time for your evaluation, take out that me file and say, look how great I am. It is important for you to have a me file. I know a lot of people, especially women, have a really hard time saying, look how great I am. But that is the time to do it on your resume, and during your job interviews, that is the absolute time to say, look how great I am. And you won't remember. If you don't maintain it and look at it, you're going to forget of all the great things that you did. Job boards and job fairs, super important. If you didn't bring your resume today, you have another chance because there's one on Friday. And I know there's one on Friday because I'm a membership. I have a membership for AAACN. I have magazine subscriptions, so all that stuff comes to you. It comes to your emails. When I'm a member of Simply Hired, you get this information. So get on those job boards. Interviewing do's and don'ts, it seems like common sense. Sense is not common, I will tell you. All the interviews that I have done, you would be amazed at how many people showed up in flip-flops or spaghetti straps, or, seriously. I see everybody here though, and I'm like, yes, you got it, you get it. You want to dress for the part that you're applying for. Be prepared from examples from your U file. A good rule of thumb, Google motivational behavioral interviewing, Google that and you'll see tons of questions online. That's how most companies interview nowadays, is behavioral interviewing. They want specific examples of how you show whatever you put on your resume. If you say you're detail-oriented, give me an example of how you're detail-oriented. So make sure you have examples of those. I just interviewed for a position about 2 weeks ago, and I took this in the interview with me. I am prepared. I make sure I have questions. I make sure I have examples. I have a letter of recommendation in here. I have an extra resume in case they need it. Be prepared and show them. Don't be afraid to be a nerd. Go in and be prepared. That will impress them, I guarantee you. Research the company. It is offensive to people that you're going in and interviewing for if you don't know anything about them. Take 10 minutes and just look them up on the internet. It's fairly easy to do. And then toot your own horn. Show them how awesome you are. Tell them how awesome you are. Ask for what you want. If they bring up salary, tell them what you want within reason. Don't ask for $1 million or you're out. And then make sure you ask questions. It's a big red flag to me if I interview somebody and they don't have one question for me. I don't think they're interested in the job. So please get some questions in your back pocket. You may have some that come up naturally throughout the interview, and that's fine. But just be really careful. Pause for effect. Don't focus on the salary and benefits and your needs. What's in it for me? How much PTO do I get? How much do I get paid? What do the benefits cover? You'll find that out. Don't focus on that because you're going to come off looking like you just want a job for that kind of stuff. Ask them thoughtful questions, but not that are really focused on your needs. Tread lightly on those ones. Lying seems like it should be pretty self-explanatory. Don't lie. You do want to toot your own horn. You want to bring yourself in the best positive light, but make sure you're not stretching that truth to where you're lying about your skills or your experience. I know it sounds like common sense, but I have had people say, yes, I've done that. I know how to do that. And then you hire them. They don't know how to do it, and it's never going to end well. Don't lie. And as much as you want to talk about that person in the office next to you who pushes your buttons and she's wrong and you're right and she's lazy and you're the best, focus on you. Don't talk negatively about your boss, about your organization, or your coworkers as much as you want to, because that person really is lazy and incompetent, and you are the best. Make sure you refrain and really focus on your strengths and make it about you and how awesome you are. Try not to ramble or clam up. If you're a rambler, make sure use those questions that you Googled from the internet about behavioral interviewing and practice with somebody. Have them just throw some questions out to you and make sure and ask them, am I rambling? Did I say enough? So practice. Don't use the same example over and over again. I wouldn't use that clinic improvement, the pillboxes story. I would not say that as how dedicated I am to be a nurse. I wouldn't use that example many times. I want to show my diversity. So make sure you have plenty of examples to show them. And then another don't is don't stress. I know it can be scary. Interviews are nerve-wracking. And I have actually done the Superman pose before an interview on the way up in the elevator because I heard that it actually helps you get the job because you're more confident. I don't know if it does, but it helped me. And I did the Superman pose the whole way up in the interview, and I just breathed through the fear because they can kill you, but they can't eat you. It is just an interview. What's the worst that can happen? And they can't even kill you. You learn from the interviews. If I don't get this job that I applied for a couple weeks ago, if I think back on it and think, how could I have phrased that better? What could I have done differently? What could have I said differently? I'm going to learn from that. So I didn't lose. I am growing. I'm cultivating. I'm going to help get myself to where I need to be. And then I'm going to leave you with this last little piece here to keep trying. It's not going to land in your lap. Keep reaching, keep struggling, keep clawing, keep scratching, not other people. Make sure that you're doing it with excellence, but just keep trying and never give up. Thank you.